Well, John, I'd like to thank you for sitting down and agreeing to talk to me and the readers of Clearinghouse Review about healthcare reform. And we're going to have a pretty informal conversation this afternoon. And I'll start out asking you, how long have you been working towards the passage of health reform?
Well, in one way or another, probably for quite a long time. But I'd say focusing on healthcare maybe 15 years, 15, 18 years, something like that.
Okay. And is that the primary work that you've been doing at the Shriver Center, or?
Well, I wear a lot of hats at the Shriver Center, but I'm the advocacy director and now I'm the CEO as well. But since about 96 or 97, I've also been focusing in a subject matter focus on healthcare. Not reform specifically, although that's always sort of a latent part of all the healthcare advocacy we've done. And so we've focused a lot on issues of expanding coverage, expanding access to doctors, affordability, and so forth.
Okay, great. Do you remember where you were when the reform passed, or what you did to celebrate?
I don't remember exactly where I was, but I do remember feeling pretty satisfied with it. I had a good few moments of celebration, and a few nice I told you so moments with some cynics that I know.
What part of the law are you most excited about?
Oh, it's such a big law, and there's so much good stuff in there. I think one of the things that's most satisfying for somebody who's represented low-income people all these years is the elimination of the Medicaid categories. So everybody is eligible for Medicaid now if they meet the means test, but they don't have to be any particular kind of person. I should add, I guess, a lingering disappointment with the fact that the exception to that is people who are not citizens.
Right.
So that's a problem to continue working on. But the big satisfaction to me, I think, is the Medicaid expansion and the sort of positioning of Medicaid as a kind of an engine for all of the other reforms, sort of a good solid base.
And what do you think reform will mean both for maybe clients that you interact with or just the everyday person?
Well, reform is going to mean a great deal for all kinds of people. For the lowest income people, especially that group I was just talking about who didn't used to be, no matter how poor they weren't eligible for Medicaid. Most of them were uninsured, and in that population is a lot of people who had a lot of medical issues that if they could have resolved those medical issues or treated those medical issues, they would have been employable, they would have been productive, they wouldn't have been violent, they wouldn't have been prone to be a victim of violence. There's a medical component to a lot of social issues and issues with equal opportunity, and so it's great that those things will be dealt with. On the larger, all across the income spectrum, there's a great possibility that affordable, decent coverage will be available to anyone. Anyone who wants to, any one of our employees here who wants to get out from under my thumb and open up their own shop, they don't have to worry about whether they can, they can't do it because there's no health coverage, right? It'll be a lot more freedom for people and a lot of freedom from worry and fear that, if they get laid off or if for some reason they have to leave work and lose their coverage, that they will be able to get it back and they'll be able to afford it. That's a wonderful thing.
How has the passage of health reform changed your daily work here at the Shriver Center?
Well, there's this great big new agenda of stuff to do.
Right.
It's a huge law. It sprawls across a whole lot of turf, much of which we haven't traveled on before. The Department of Insurance, the market regulations, the exchanges are a whole new animal. There's a very complicated agenda for work on the state level, both here in Illinois and elsewhere. We're hoping to be helpful, and on the federal level and the interface between federal and state. And I think right in the foreground there's a tremendous front porch issue that some of us are missing, which is this difficulty with state budgets. I think we really have to aggressively address the state budget crises in order to get a robust and confident implementation of healthcare reform.
And what's your vision for how healthcare reform is going to play out in the short term as opposed to things that are going to take longer to enact?
Well, in the short term, there's a lot riding on an election about a month from today. Because, regardless of how it comes out, and in all the different states and in the federal, the course that this takes will depend heavily on what happens in those elections. We're going to have to get past the battle of whether this law is the law and whether it will remain the law. So in the short term, there's a largely political battle over whether the nation is really going to take this step. I think we'll get past that. Also, regardless of the elections, interestingly, I think that'll simmer down. More and more people are starting, as the pieces of the law start to become effective, and a bunch of them did about a week ago. People will get more, and it'll become more and more a fait accompli. People in the states where their governors are dragging their feet are going to say, "Come on, this train's leaving the station. Yeah. Our state needs to be on it." So that's the short-term battle. The long-term battle is actually the battle to not only implement this law properly, but to do the full reform. To control the cost of health care, to make sure everyone can get it, that it's affordable for everyone, and that there's a focus on prevention, avoiding avoidable health care problems, and that it not matter who you are or where you came from, that this is something you can get in this country. This law is a huge step. It moves the ball way down the field, but it's not all the way there.
In that regard, do you have any advice for advocates that are working in the healthcare area right now, either about the reform or advocacy in general?
Well, sure, I got a ton of advice. How long do you want this show to go on? But I think the thing is to learn it, to understand, especially for lawyers, to be a resource for the technical pieces of this, and then to also understand that there's a political battle to be won, not in terms of electoral politics, but in terms of hearts and minds, and getting this entrenched as something that most people in America want. So there's a lot of relationship building and messaging and those things that need to be done, in addition to the technical work to get a good solid infrastructure in the law for these programs.
Great. Well, thank you, John, so much for taking the time to sit down with me and with the interested readers at Clearinghouse Review.
My pleasure.